Kansas City University College of Dental Medicine in Joplin recently earned initial accreditation and will start accepting applications from potential students starting this summer. Joining us today on Newsmakers is Dr. Linda Neeson, Dean and Vice Provost for Oral Health Affairs, to tell us, what does this mean? What is this accreditation? Why is it so important?
So Bobby, this is a very important step in the development of a College of Dental Medicine. Initial accreditation means that the curriculum that you have identified meets all of the standards of the Commission on Dental Accreditation, which is the body that oversees accreditation for all dental education programs, whether it's dental hygiene, a dental program, or advanced education like specialty training. Mm-hmm. So by them coming to, they've reviewed our curriculum, they've had a site visit, asked us questions, and then basically are now saying, yes, you meet the criteria for initial accreditation. So it assures students who decide to come to Kansas City University College of Dental Medicine that they will get a good education that will allow them to become the dentist they want to be.
Mm-hmm. So it's sort of an industry standard you have to meet in order.
Yes, I think that's a very nice way of putting it. It is an industry standard. It's a national standard. And we are the 70th dental school. Every other dental school has to be accredited as well.
Wow. And so what goes into it when you say they have to approve your curriculum? What is that?
So what the curriculum is what we're going to teach the students over a 4-year period. Mm-hmm. So we had to lay out our 4 years of dental education when they learn the foundational knowledge or the basic sciences in the first year. In the second year, when they learn how to do the dental procedures in a simulation lab. We have a little, they work on plastic teeth and learn how to do the procedures. The third year, they'll be in our clinic seeing patients. We will welcome people from the community who need dental work to come and have dental work done by the students. And in the fourth year, the students will be in the clinic, but they'll also be in community health centers throughout the state. So the commission came, they reviewed what we'd put in writing, they come and visit to make sure, they ask us questions, can you do what you say you're going to do? And then evaluate, this plan and approve it. So it's a very rigorous process, and I'm really pleased that we, succeeded in becoming accredited or receiving initial accreditation.
And so that was probably a happy day on campus.
It was a very happy day.
And they're still building the building.
Yes.
What is going to be in that part of the building?
So I like to say we're building our home, our dental home. This will be our clinical facility where the students will take care of patients, and where patients, if people who may not have a dental home, may not have a dentist, can come and get dental care that they need. We're looking at it as it's our building to improve health for everyone through dental health.
Yeah, and so kind of a clinical setting, if you will. What are the, requirements for somebody who wants to get into a clinic?
To dental school.
Yeah.
So to get into dental school, it's a scientific discipline. So it's not unlike medical school. And while you don't have to have a bachelor's degree, to meet most of the prerequisites, it's often easier to have the bachelor's degree. So it's 1 year of general biology, it's 1 year of general chemistry, 1 year of organic chemistry. The organic chemistry is the course that often separates the people who think they want to go to medical or dental school and really do. A year of English. You have to be able to write. Everyone thinks scientists don't need to write. And all the biology majors go into biology because they say, I hate English, I don't want to write. The truth is, you've got to present to your patient. You've got to present to your colleagues. So writing and communicating is really important. So I would say your students who are communication majors would be excellent candidates. They take some biology. They're going to be able to communicate with patients really well.
Yeah, if you've got a head for that. I mean, I did not do well in physical science and
you know what?
Biology.
I think every course has a time.
Right.
And while you may not have felt you were good at it when you were in college, I'm willing to bet we see students who come back 5-10 years later and say, gee, I wasn't good, I was an arts major, and yet now they can do the science because they've set their mind to it.
Sure. And non-traditional students seem to do better anyways because they're there for a reason.
That's right.
It's not I'm just going to college. It's, I'm doing it for a reason. Well, so talk about our region. Right now we have the designation of being a dental health care professional shortage area. Talk about that and the serious health gap.
So a dental health professional shortage area means that the communities don't have sufficient number of dentists to get their dental needs taken care of. And Missouri, Kansas, Oklahoma, and Arkansas all are in this area. And what we learned, we did a study prior to starting the dental school to see if there was a need. And what we learned is in this area there was not only a shortage of dentists, but also the number of dentists were approaching retirement age. So the only way to really meet that need is to develop a pipeline for new dentists. So a College of Dental Medicine was the answer.
Completely makes sense.
Yeah.
Well, and so talk about how many dentists are needed to get us out of that designation, or is there a number?
There is a number. And the number, there's an algorithm for how they determine,
Math.
And it's various variables.
Sure.
It's the number of dentists currently, the number of people in the population, the poverty rate in the community, the income status. So it takes in a lot of different variables. And I think for Missouri, there's like 376 dentists that are additional dentists are needed. I think in Arkansas or Oklahoma, 166 are needed. So these numbers are sizable.
Yeah.
We're going to have a College of Dental Medicine with a class of 80 students. So it'll take a while for the College of Dental Medicine to add to the numbers that are needed. But when you look at Oklahoma, that has one dental school, and Missouri that has two, that are in Kansas City and St. Louis, and then Kansas and Arkansas that don't have any.
Wow.
They don't have any dental schools. So our dental school really is strategically positioned to help meet the needs of Kansas, Arkansas, Oklahoma, in addition to Missouri.
Man, that's crazy. I wouldn't have ever thought Arkansas, like Little Rock's big enough, you'd think.
Little Rock is big enough, and Little Rock has talked about it on and off, but they've never, the university never decided to start a dental school.
How about that? Well, and so also, along with contributing the number of dentists and making that a better number, it's also going to contribute financially to the area.
There's no question. The economic development of the College of Dental Medicine, I mean, we're going to have 80 students in a class. That's 320 new students to the area. Wow. And they will stay in the community because dental school is 4 years. Unlike medical school where the medical students go to rotations, they're third and fourth year. So our students will stay in Joplin. We're going to hire 102 faculty and staff, some of whom will be new to the area. So we estimate that the economic development cost will generate, excuse me, I'm not saying this correctly. Let me try this again.
You're good.
That the College of Dental Medicine will contribute $45 million to the economic development of the community and about 1.7, almost 2 million in additional taxes in state and local taxes.
Yeah, because these aren't low-paying jobs. These are professors and
the dental students aren't getting paid, but the faculty, faculty and staff, and KCU is a wonderful employer.
Right.
So KCU does, I believe, pay a very fair wage and provide excellent benefits. So it's a great place to work.
So could a retiring dentist become a professor or instructor?
Yes, actually, I anticipate that a number of our dentists here in Joplin and the surrounding area may become faculty members, even if it's just for 1 day a week. They may come in, they have a lot of expertise. They've been in practice for 20, 25, 30 years. They understand how to take care of patients. And the students, when they're in a clinical setting, taking care of patients, just absorb that knowledge. They're just sponges. So they want to hear from dentists who have that real world experience.
Well, and it would probably make a dentist who's been practicing for years and they don't want to give up their practice because they're patients. They want them to be in good hands. So the fact that they're training future dentists would probably make them feel more comfortable and maybe able to retire.
One of the things that I've seen in dental education, the part-time faculty who come in 1 day a week, when you work in the dental school, you see who the students are, who has the personality that matches yours, who does dentistry and makes treatment planning decisions the way you do. So you basically have a sense of picking your future associate. You know, you can say, oh, I think I like this.
Yep.
I like this. I'm going to keep my eye on this student. And when this student graduates, see if the student wants to come into my practice.
There you go. Yeah, mentoring them.
Yeah,
basically.
exactly.
So what is the application process like for someone who wants to apply to the dental school?
So the application process is actually quite easy. The American Dental Education Association, ADEA.org, has a web-based portal. All of the applications go through this web-based portal. It's called ADSAS, AADSAS.
Okay.
And it's the American Association of Dental Schools Application Service.
Okay, and we'll put that up so that viewers
so people can
see it.
And you basically apply. You fill out the application online, enter it through the portal, check off which schools you want to apply to. So I would say I think all 70 of the dental schools use this portal, and you just check off, you know, here's where I want to, and you submit your dental admission test scores, your transcript with your GPA, your letters of recommendation. So it just goes, so you basically fill out one application.
Like a clearinghouse.
Like a clearinghouse. And then once the website, the portal determines you have everything, then the application goes to all the schools.
Okay. So what if you don't get, say you live in Joplin, you want to go to school in Joplin. Do you just pick Joplin, or do you pick someplace else just in case?
So usually dental student or applicants usually apply anywhere from 8 to 10 to 15 schools, just to cover their bases, to hedge their bets. So you pick, you know, where you think you'd like to go, and just like college, you know, you pick the stretch school, you pick the school you know you're going to get into, and then all of those in between. So it's similar.
So what prerequisites? You were saying that you have biology and chemistry and English. What does a student need to get or have to get into dental school?
So to get to basically meet our gating criteria for having the prerequisites would be the year of general biology, the year of general chemistry, the year of organic chemistry with labs, the year of English. I think we have microbiology, 1 semester of microbiology, and then additional biology courses that, you know, would fill in, because the more biology courses, usually it becomes easier for you. Human anatomy, we recommend a human anatomy course, because you're going to have anatomy. That'll make the curriculum easier for you. So, and then biochemistry.
So we were talking, Missouri Southern has a dental hygiene program. Do you see that as being a feeder for the KCU Dental School?
I hope so. Missouri Southern has a biology department. Missouri Southern has a chemistry department. And I'm hoping, and even a philosophy and arts and sciences department. Again, students who could be English majors or philosophy majors or biology, chemistry, communication, or dental hygiene majors all could meet the criteria by completing their degree and having the prerequisites. There really isn't a major that excludes you from applying to dental school as long as you have the prerequisites. And each of those different disciplines add a value. You know, the communications people are going to be able to communicate better. If you have a business degree and you have the prerequisites, you're going to be able to, you know, understand the business. If you have a dental hygiene degree, that's a bonus, because you're going to be really prepared for dental school, because you've already taken care of patients. You understand the dental terminology. You understand the process of care. So, you know, dental hygienists who come to dental school have a real added advantage.
Yeah, I would say, plus they've already spent however many, you said there's a number of hours required? What our school has? The
dental hygiene program, my understanding of Missouri Southern's hygiene program is it's a 92 credit hour course. So it's 3 years, so to speak. If you stay that additional year to get another, you know, 28 credits, so you have 128 credits, now you get your bachelor's degree, and those 20 credits could be the biology you know, requirements that you need, or the chemistry prerequisites. So the dental hygiene students are pretty darn close to having all of the prerequisites.
Yeah. And we have the nursing program as
And
well.
the nursing program, nurses make great dentists as well.
Oh, I bet.
As the hygiene students, yeah.
Wow. So from beginning of the application process until they find out, say they're accepted, how long is that process?
So the application process, the portal, the web-based portal will open in May or June. I believe it's June 1st. And then it takes, like a month for all of the materials to get into the portal, so then the applications come to the school. We anticipate starting interviews probably in September, October, December. The first acceptances in dental school, all of the dental schools have a pact. We don't announce any acceptances until December 15th.
Gotcha.
So that's when students will first learn that they'll be accepted, and then we'll continue to accept students, until they start.
Okay.
Which would be, July or August of 2023.
That's getting close.
Yeah. But people drop out. We've had examples of students who start one day and say, medical school isn't for me, and they leave.
Really? After a day?
After a day, yep.
What's so shocking in the first day?
I don't know, but they realize that this isn't what they want to do, and fortunately most schools have a wait list, and you take students from the wait list.
Wow.
Off the wait list, and they come even if it's day 1 or day 2.
And how long did you say dental school was?
Dental school is 4 years. It's just like medicine.
Okay, so you take your initial 4 years in say at Southern, and then you have to go an additional 4 years.
4 years for your Doctor of Dental Medicine degree.
Wow.
Now the difference between medicine and dentistry is dentistry, we have to educate the student to be practice ready when they graduate.
Gotcha.
So they'll graduate on Sunday and they'll go into practice on Monday. In medicine, they graduate on Sunday, but they have 3 more years of residency.
I gotcha.
So, or 4 years or 5 years, depending on their discipline. So dentistry is different in that regard, which is why we have the simulation lab and the clinical facility, because the dental students have to learn how to take care of patients before they graduate.
So is KCU Dental School, here in Joplin, are we going to see orthodontics and oral surgery, are all of those part of the curriculum as well?
All of those are part of the curriculum. Our goal is to educate a practice-ready general dentist.
Okay.
So general dentists do extractions like oral surgery.
Sure.
They might do some orthodontics using Invisalign or some minor tooth movement. They'll do some root canals. The practice of general dentistry, the dentists do all of those. So we have to educate students to do those procedures at the level of a general dentist, not at the level of the specialist.
Okay.
Okay, that's kind of a unique difference, where the specialist who only does oral surgery is, moving faces and, putting, doing sophisticated surgery and really complex
more of a
extraction.
medical school thing than a dental school thing.
And an endodontist who does root canals would do complicated root canals.
Okay.
Where the general dentist would say, okay, I might do an anterior tooth that has a single root, and then if I get in trouble, I'll refer it to the endodontist, the root canal doctor. Yeah.
So will they learn how to do bridges and what implants, things of that nature?
They will learn all of that. We will have a CAD CAM or a digital design laboratory, so that the student right now, remember, if you take an impression, you took an impression and you got a lot of goop in your mouth. The goop is going away. Good news.
Wow.
Goop is going away. We do it all digitally now. The student will do the preparation, make the tooth the right shape to hold the crown, but instead of putting the goop in to take the impression, they use a camera. An intraoral camera, scan the tooth, send that scanned image to, you guys understand digital, because your whole industry has gone digital, right? We send it to the laboratory, and then the laboratory has a milling machine, and we'll take that image and mill the crown and make the crown, and we will have the milling machine on site. So theoretically, we could do it in a day.
Wow. Does it work for dentures like that as well?
It is, and they are now doing digital dentures too.
That's
that's amazing. Isn't that amazing?
It would cut down on so much, bad, dentures coming back and not fitting, and having to drill them down and send them back and refit. That's an awful process.
We will be doing digital dentures. We may be doing traditional dentures too.
That's great.
but it's a really exciting time in dentistry because the technology is really advancing. So the procedures that were very labor intensive for a long time are now becoming driven by the technology, and they're more precise. The technology makes them more precise. That's what's so amazing.
Yeah, cut down on the mistakes made. Wow, that alone, I've got a couple of friends who would be very excited about that.
And the other thing is, like, when we do a denture, like a lower denture, we'll probably place 2 implants, you know, because a lower denture by itself isn't a good restoration, very good restoration, whether it's made the traditional way or with the computer, the digital design. It's the fact that there's nothing to hold it in. So if you put 2 implants there and then put the lower denture, now you have something to hold on to.
Makes so much sense.
Makes so much sense, and it's much more comfortable for the patient.
Wow. So what would you give, or recommendation-wise, or about to someone who is thinking about becoming a dentist?
So my feeling is, if you're thinking about becoming a dentist, first thing is to go visit a dentist. Visit a private practitioner, visit a hospital.
Not as a patient.
Not as a patient, no. But you know what? The biggest recruiter of dentists are orthodontists.
Well, that's
because every young person goes and gets their, you know, they've had crowded teeth, they go to the orthodontist, the orthodontist straightens their teeth, and they say, this is an amazing field, I want to do this. I want to make, you know, and these young people, you know, have this smile that they never had before. So orthodontists are very successful at recruiting dentists. My feeling is you go visit a dentist to see what they do every day. The important thing is to understand what they do, and if that's something that you think you want to do. And most people are familiar with, you know, ortho, or if they have pain, going to the dentist to have the tooth taken out, and how the dentist relieves pain. And we're familiar with, you know, the dentist making pretty white teeth.
Right, the way it looks.
What we don't appreciate about dentists is that they save lives. And I think there was just a wonderful example of a dental hygiene student here at Missouri Southern who diagnosed a lesion, a sore, in the mouth of one of her patients. Actually, it was reported on the media, future father-in-law, and it turned out to be an oral cancer. So dentists and hygienists save lives and contribute to your health. And that's the part that people don't always realize. And you truly can make a difference in somebody's life by, you know, if you have diabetes and may not realize it, but yet your gums are red and puffy, and the dentist might be able to identify that.
Recognize the signs. So will KCU Joplin Dental School, will you guys take insurance, Medicaid? How will that work?
We're building and planning our clinic now. And we plan to take insurance. I mean, in the dental world, you know, dentistry is maybe a $120 billion industry. And of that, about half of that is funded by dental insurance. So dental insurance helps a lot of people get care. We also know that of that $120 billion, about $10 billion is public insurance, which is Medicaid. So Medicaid helps a lot of people get dental care. So we plan to take, you know, dental insurance, whether it's private dental insurance, Blue Cross Blue Shield, Delta Dental, Aetna, or the public insurance, which is Medicaid, to make it easier for people to get the care that they need.
That's great, because there are a lot of kids and dentists who can't see them after a certain age with Medicaid because they've had no care. And it's hard to get into a dentist.
It's very hard. Medicaid is not an easy program to work with. However, we're going to try our best and educate our students that this is part of your professional responsibility. You just don't care for the affluent people, you care for everyone.
Well, and it makes such a difference, especially if you get them young. And like you say, you know, it's preventive care. And you need, like, use your dental insurance because that's prepaid.
You've heard me say that before.
I have.
That's right. It's not insurance, it's prepayment. If you have it, use it.
Well, that'll be good for, and like you said, it's going to fill the dental gap, but also the healthcare gap.
Exactly. It's estimated that for every 4 children who have a, you know, eligible Medicaid card, only 1 of those 4 children gets the dental care to which they're entitled. So that means there's 75% of those children aren't getting dental care to
going
which they're
without.
entitled and probably need.
For sure.
So we want to make sure that our dental students understand that their professional responsibility is to care for all of the children in the population.
Yeah, it'll be great. Well, and one thing we were talking about earlier, I was noticing that most of our dental hygiene students are all women, practically.
Yeah.
And what's your take on that? Why and can that translate to becoming a dentist?
Well, certainly. So I don't know why dental hygiene started out and became, an all-female profession, not unlike nursing. Sure. Nursing is primarily all-female. What's interesting is 50% of the dental students now are women. 50% of the physician medical students are women. And over more than half of the veterinary medicine students are women. Veterinary medicine has become primarily women. So, I don't know why, but I do know that if there are women who are hygienists who are interested in coming to dental school, all they need to do is complete the prerequisites.
Right.
They're pretty darn close to having the prerequisites completed, and they have the added advantage of they know how to take care of patients.
Yeah.
They've seen patients, they know all the dental termini, they know the instruments.
Right.
They know. Dental hygienists have a big edge when they go into dental school.
Well, that's a bonus.
Yeah.
Well, thank you so much for coming and talking, and congratulations on the accreditation.
Well, thank you. It's a pleasure, and I'm hoping that there's lots of Missouri Southern students who are thinking about a career in dentistry.
Yeah, and bringing jobs to the area.
Exactly.
We're so excited.
Yeah, it's a very exciting time right now.
Thanks for joining us today. I want to thank Dr. Linda Neeson, Dean and Vice Provost for Oral Health Affairs, for joining us today. This is Newsmakers on KGCS TV from the Ruth Copeland Studios here at Missouri Southern State University, and I'm Bobby Potroff. We'll see you again soon.